Good morning and thank you for joining us on Thriving on the Suncoast. Did you know that May is National Stroke Awareness Month? Health South will be having an open house promoting their excellence in stroke rehabilitation. It's going to be this Wednesday the 10th from 10 a.m. to 5 in the afternoon. Events all day, classes in art therapy, Tai Chi, healthy cooking, along with health screenings and great lectures. Call Amy at Health South for more information. The Gluten-Free Expo and Healthy Lifestyles is this Saturday, the 13th from 10 to 5, also at the Sarasota Memorial Auditorium. Stop by the Comfort Keepers booth for insight on how to keep a loved one at home and a sneak peek at this revolutionary technology, the Helo, which is one of the latest in wearable technologies. It allows you to track and record your health metrics, and you can even monitor your loved ones and be alerted if their key indicators are out of the norm. Feel free to contact me for more information on this exciting tool to manage your health. Today's topic is Medicare. Medicare is the federal insurance program created in 1965 for people aged 65 and over, regardless of income, medical history, or health status. The program was expanded in 1972 to cover people under the age of 65 with permanent disabilities. Today's Medicare plays a key role in providing health and financial security to 55 million older people and younger people with disabilities. As with most government plans, it comes with many ever-changing and confusing rules. Here to provide us with the facts is Frances Lane, an independent insurance agent with First Benefits Group. First Benefits Group is a life and health insurance agency based in Sarasota since 1995. Fran has been in the insurance industry for 17 years and prides herself on helping her clients determine the right insurance for their unique needs. She enjoys giving seminars on Medicare, Social Security, and planning for long-term care. Fran is the current president of the Gulf Coast Health Underwriters. Fran, welcome to the show. Thank you so much for being here. There's probably a lot of misinformation. You've been doing this a long time, and Medicare, Medicaid, it's all kind of runs together. And until you really are in the thick of it, it really takes a lot of understanding as to what's covered, what's not, and so forth. So kind of set us straight on, maybe start with what the difference between Medicare and Medicaid is.
Okay, that's a good place to start because people often use those words interchangeably. But Medicare, as you know, is a federal government health plan for individuals aged 65 and older and for younger individuals with certain disabilities. Medicaid, I always remind people, think of Medicaid state aid. That is a specific program for individuals with a low income. So that is primarily the difference between the two plans.
Mm-hmm. So Medicare is a primary health insurance for most people. I guess you can get it when you turn 65. What is the rules around enrolling for that?
Here are the rules, and I get this question a lot. People call me on the phone and say, I'm turning 65, what do I do? If they call me before they're 65, this is good because I can guide them. They can enroll in Medicare 3 months prior to their turning 65. They can enroll the month of their birthday when they are 65, or they can enroll in Medicare 3 months after age 65. So they have a 7-month window in which to enroll in Medicare. So there's plenty of time to get that done.
Is there any reason not to enroll in Medicare?
There possibly some people that are still working for their employer, for example, they might want to opt out of Medicare Part B, which would be the outpatient doctor visit, but they would definitely want to enroll in Part A, which would be the hospital skilled nursing facility.
And we'll come back and talk a little bit more about all these different parts in a minute. So how do they go about enrolling in Medicare?
You can enroll in Medicare by going online to www.medicare.gov. It's a very easy website. They'll say, what do you want to do? And you'll say, I want to enroll in Medicare. It'll walk you through the steps. You can also go to the local Social Security office, which is located at Siesta Drive in 41. They close at 3. So if you're going to go, probably a good time to go is around 10 o'clock in the morning. Or they can call me. I'll be glad to make an appointment at, of course, no charge, and walk them through the steps and show them how to do that.
So what are the components that make up Medicare, and what do people need to know about that?
Medicare is basically divided into two parts. Original Medicare is two parts. Part A, which would be hospital and skilled nursing facility, and Part B, which would be outpatient or doctor visits. A note on Part A, which I said was the hospital, something to be aware of is that is inpatient hospital. It means you're actually admitted into the hospital as a patient and the Part A kicks in. You might have heard the term observation lately.
I suspect a lot of people haven't unless they've been in the hospital, but that's a really important topic to discuss. So we're talking about somebody who goes to the hospital and when Medicare is going to pay, and there's kind of been some changes in how the hospital has been handling admitting people and calling them an inpatient.
Right, exactly.
And so why don't you explain what's been happening?
What has been happening, and we're seeing it a little more now, is the patient comes into the hospital and they're placed in what's called observation status or observation outpatient status.
Is that hanging out in like the ER?
You may not necessarily. You could be in a room, but if you're under an observation status, it's not going to be paid under a Medicare Part A.
So that's really critical to understand. I mean, you're in a room and you're thinking that, hey, I'm in the hospital, Medicare's paying for this, and yet they've deemed you an observation status. So why don't you explain what that means and how would somebody know what status they're in?
The first thing that I would advise people is to ask that admitting physician or someone that you're working with, what is my status? Am I an inpatient? And I am observation. If they're in observation, you want to ask them to put you on an inpatient status. However, if you're very ill, you may not be thinking all that clearly, so it's good to have someone with you. For example, my husband recently had pneumonia. I took him to the hospital. They put him in a room, and I specifically asked if he was under observation status or inpatient because this was not the room he was going to be in. And they said he was an inpatient status. However, if you hear that word observation, you do want to ask to be inpatient. Observation is going to put you in the position where the Medicare Part A is not going to pay because you're not an inpatient.
So you haven't officially been admitted to the hospital.
Right.
They're observing you.
Yes.
And and all of a sudden you get out of the hospital and you get this bill and Medicare's not paying it and you owe a whole lot of money.
You owe a whole lot of money. Now, if they...
That's pretty upsetting.
It's pretty upsetting. It's pretty upsetting. So ideally, if you're that outpatient observation, the Part B, if you have Part B, will cover that because it's covering outpatient, but it could be tricky.
We're going to go to break. When we come back, we'll hear more about observation status. Stay with us.
Is Mom really taking her medications?
A Comfort Keeper can ensure that your loved one gets their medications on time, providing peace of mind for families in need of flexible in-home care. Comfort Keepers, let our family take care of yours.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Let's face it, life happens, and the laws change daily. Attorney Joseph Land can help guide you with legal issues you may face while aging. Len Law has helped countless clients in Sarasota and Port Charlotte in assistance with guardianships, Medicaid planning, VA planning, estate planning, wills and trusts, probate, and Social Security disability claims.
I'm elder law attorney Joseph Land. At Len Law, seniors matter. Your rights matter. And the legacy that you built matters.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
Welcome back. I'm here with Frances Lane, First Benefit Group. We're talking about Medicare. We were talking about Parts A and Part B and the differences, and that when you go into the hospital, different parts pay for different things, and that if they deem you to be in observation status, then Part A may not cover you, and so you have to be careful. You want to continue with that?
Yes, I'll continue with that. Generally speaking, when people enroll in Medicare, they do enroll in Part A and Part B. If you were placed in the hospital under that observation status, your Part B should cover the cost of that. However, there are instances that people may not be enrolled in Part B, and as we move along a little bit and talk about the parts of Medicare, I think that might be a little more clear.
Well, that's a little less scary knowing that there's a good reason to have both parts
Absolutely.
these days, because from what I hear, a lot more and more people are being put in observation status. And
They
it has
are.
something to do with readmission expenses and so forth. It saves the hospital money. So if you're 65, and you're still working, should people sign up for Medicare?
If you're 65 and still working, you do want to sign up for Medicare, but generally what you would do is sign up for Part A, which is that hospital skilled nursing part. Part B is the outpatient and doctor visit. If you're working and you have a group health insurance plan, you probably are paying for the group insurance or paying for a portion of it. So therefore, people may not enroll in Part B because they don't want to pay two insurances, because there is a cost for Part B.
So no cost for Part A, but Part B there's a cost.
Right. When you were working and paying taxes, you know, you get your paycheck stub and you see Medicare, you're basically paying for Medicare Part A. However, Part B, there is a charge. Most people, the monthly charge for Part B is $134 a month. So if you're working and you have group insurance, you're probably paying a premium for your insurance. So you don't want to pay for two insurances, and you don't need to pay for two premiums.
So do you feel like we've covered the parts? Are there other parts that we want to talk about now?
I
or?
think for basic original Medicare, we're pretty good with Part A.
Okay.
Part A and Part B.
So there's other plans that aren't purely Medicare. They're called Medicare Advantage plans.
Yes.
Can you explain the difference for that?
Yes. Medicare Advantage plans came along as another alternative. They are plans that are owned by private insurance companies, and therefore private insurance companies kind of dictate how the plan is designed, but it must cover all of the benefits of basic Medicare, and that has to cover hospital and skilled nursing facility, doctor patients, outpatients. But they are private plans, and therefore they can have specific networks that you may need to work with, and they're designed in some cases as a pay-as-you-go service. There may not be a plan, a fee for there may not be a premium. You may not charge for the plan, but you pay as you go for services. You may pay for your hospitalization as you're receiving care, or you may pay the doctor visit or the lab visit as
So
you
the Advantage
receive care.
plans, you're saying, may not have a premium up front?
That's correct. Some of them may not have a premium.
So there's many different plans on the market?
There's
or?
several different Medicare Advantage plans on the market, and they are by several carriers, some national, some local. The thing to be aware with Medicare Advantage plans is always that network. You want to make sure the providers that you like to see are in the network and are accepting the plan. That's the key element. And be prepared to pay for some expenses as you go, because sometimes they are no premium, but you will pay for fees as services are provided.
So I suspect you hear pros and cons about Medicare versus
Absolutely.
Medicare Advantage plans
Yes.
and so forth. And what would you say the big difference is?
The big difference is, from what I see, is choice.
So you save money with an Advantage plan as
Yes.
far as a premium goes.
Right.
And all the services are supposed to be there.
Yes.
You're limited to a network of doctors and providers.
Right. Sometimes you are limited. You may have some out-of-network coverage.
It doesn't sound so bad, but there probably are other limitations somewhere.
What you have to do is, when you're looking at the Advantage plan, and what I try to educate my clients is, I read through the entire document so that they will know that if they're in the hospital, they will be expected to pay that daily rate that the company has told them they'll be responsible for. Now, they may only have to pay it for the first 4 days. Usually after that, the plan will absorb the cost. They need to be aware that they will be responsible for that fee. They may be responsible for some other fees as they go. Bottom line is there's always a stop loss. For example, you may have a situation that, say, the total cost for that care is $100,000. You're going to be responsible for some of the cost, but there's a stop loss.
Got it.
It would vary between $6,000 to $10,000 as your stop loss.
Are there things that Medicare doesn't pay for?
Yes, there are things that Medicare doesn't pay for. Medicare doesn't pay for, and they will list them specifically, it doesn't pay for acupuncture, it doesn't pay for hearing aids, it doesn't pay for dental services, it doesn't pay for routine eye care. Now, it does pay for vision visits like glaucoma screening, macular degeneration.
Very specific things.
Very specific things, but not general routine vision care.
So what, is there a supplement to Medicare other than the Medicare Advantage plan?
Yes. If you are in original Medicare and enrolled in Part A and Part B, you can purchase what's called a Medicare supplement, which is exactly that. It supplements what Medicare doesn't pay. That
So
again,
if you really want a Cadillac and you want to cover all your bases and, you know, basically fills in the loopholes, I guess?
yes, it would cover for copays and deductibles. For example, if you had original Medicare and were admitted to the hospital, you would have a hospital deductible, just like you would with a major medical plan. But if you had a supplement, it would take care of that for you.
How are prescription drugs covered?
Prescription drug coverage is a newer part of Medicare, and it's called Medicare Part D. D obviously for drug plan. Those are private plans that are owned by private insurance companies, but they are designed according to strict Medicare guidelines on how they're set up. They're generally set up with a deductible and copays and coinsurance, and there's a charge for those plans. And the charge for the plan, the premium, varies from a low of $18 up to, can be over $100 a month per plan.
We have to go to break. Check out our sponsor. We'll be back to find out more about Medicare and Medicare drug plans. Stay with us.
The Harvey Center for Integrative Medicine is helping people every day to thrive and live healthy, vital lives. Our integrative approach combines conventional medicine with holistic and innovative therapies to help you achieve optimal function. Are you ready to function at 100% of your ability? Dr. Fred Harvey customizes tools and treatments to achieve optimal wellness at any age.
Hi, I'm Dr. Fred Harvey. Do you want to feel vital, vibrant, and fully energized? If so, call our office to find out how.
Let's face it, life happens, and the laws change daily. Attorney Joseph Land can help guide you with legal issues you may face while aging. Len Law has helped countless clients in Sarasota and Port Charlotte in assistance with guardianships, Medicaid planning, VA planning, estate planning, wills and trusts, probate, and Social Security disability claims.
I'm elder law attorney Joseph Land. At Len Law, seniors matter. Your rights matter. And the legacy that you built matters.
When a stroke or injury impacts your life, we're here to help you get it back. With our dedicated team of specialists, personalized treatment plans, the most inventive technologies, and a coordinated approach to recovery. This is more than just rehabilitation. This is a higher level of care.
Welcome back. I'm here with Francis Lane, First Benefit Group, talking about Medicare. We are on the subject of drug plans, popular subject for a lot of people. Not the good drugs, by the way. But anyway, tell us a little bit more about the cost and what's covered. It's a separate component of the Medicare plans?
Yes, it's important to note that it's entirely separate entity from original Medicare and that it's called Medicare Part D or prescription drug plan. As I stated, these are private plans. You buy them from insurance companies. This is where an agent can really help you out, to make an appointment with that agent to come in. First of all, most people 65 and older are on multiple medications, and they may not understand how these drug plans work. So I can sit down with them.
I can't imagine anybody understanding how any of these plans work without some help. I mean, you got them all spread out on the table, I would imagine.
I was going to say, having done this for 17 years, it's easy for me.
Yeah, well.
Which is another reason you'd want an agent. So generally when I'm speaking with someone on the phone, I'll ask them if they'll give me their permission to either bring in their prescription medication or give it to me.
Well, that's a key component of figuring out what plan to be on.
Absolutely.
Because different plans allow different drugs.
Yes, they do.
Yeah.
They do vary.
Very confusing.
And that would be something that I think would be hard for the person to go and figure that out unless they have a little bit of medical savvy. And if you don't, then just hand that burden, put that on my desk. And
then the drugs have so many different names, don't they?
Absolutely, they do. And what might be considered a generic drug with one company may be a preferred generic with another, or brand name. So I can walk them through that, and we can go together, and I can give them, I usually give them 2 or 3 options to let them pick, so they'll see where their drugs fall. This is going to let them know what the premium for the drug plan will be, what their cost will be. If they're a generic medication and it's a generic, it might be a 0 copay. They charge the plan, but they don't charge the patient. Where if it's a preferred generic, there might be a copay, and that might be different with different companies, so they'd want to know that. Where the expense occurs is going to be in brand name drugs. I call those the after 5 drugs, the drugs you see advertised on television at after dinner, which they're good drugs, but obviously they're going to be costly, but for some people that may be the route they need to go. So that would be my job, to walk them through that, and let's look at a plan and see where it falls as far as how it falls as far as price is concerned. That would be something I could walk them through.
There was this problem with the plans in the past that had what was called a donut hole, because it would pay and then stop paying and then pay again.
Exactly.
Is that still around?
That's still around. That donut hole gets a little smaller each year, which is a good thing for the patient. However, if you're on some brand name expensive drugs, you can get to the donut hole pretty quickly. For this year, if the total that you spent together between what you pay and the plan pays reaches $3,700, then you're going to be in that donut hole. Now, if you're on some expensive brand names, you could get there fairly quickly. Now, if you're on a lot of expensive meds, you can get back out of it, because once your total cost reach $49.50, once you surpass that, then you're out of the donut hole, and your cost is going to be 5% or a specific copay that's indicated by the plan.
Do you have clients that have been buying their drugs from outside the country, through some of these Canadian plans and so forth?
Yes.
Does Medicare pay for that?
No, Medicare does not pay for that. I call that cash and carry plan, and that would be something the patient would utilize and could utilize. It might be something they could do that would help them avoid getting in that donut hole. They may pick to purchase one plan or one drug in that system.
So there's a lot of analysis that really needs to be done.
Yes,
Yeah.
yes, and it's really hard to just go online and plug your information in and come up with the drug plans. It doesn't walk you through those nuances that I can walk you through.
So let's talk about another major aspect of Medicare and health care, and that is long-term care costs. Somebody goes in the hospital, they have surgery, and then they need some kind of rehabilitation.
Yes.
What are their options coming out of the hospital?
There are a couple different options. One thing to keep in mind is if you've been in the hospital, in order to actually go to a skilled nursing facility and have Medicare cover the cost, you need to be in the hospital for 3 24-hour periods.
So you have to have a 3-day qualifying stay in a hospital
Yes.
for Medicare to pay once you go into a rehab facility.
Right, exactly.
Is that the same thing for if you went home?
No, not exactly. Let's say, for example, you were in the hospital and you had some type of surgical procedure. You had it one day, you were released the second day, so you were in the hospital basically 1 24-hour period because you were released, but you had some surgical procedure, you need a skilled nurse to monitor that. So that would be skilled nursing care at home, and Medicare would pay for the skilled nursing care at home in that case. However, let's say you were sent home and your skilled nurse is going to come in and take care of that wound, but if you're home and you live by yourself, you might want someone to help you with bathing, eating, or dressing. That would not be covered by Medicare because that would be considered assistance with activities of daily living.
So basically, when you go home from either rehab or the hospital and Medicare comes in, they're only going to come in for short skilled visits, skills like nursing, like physical therapy, things like that. But they don't cover any of the other activities of daily living, shopping, transferring, helping you into the shower, bathing, feeding, dressing, all the activities of daily living that you mentioned. And that's when private duty would coordinate care with you and the Medicare agency in the house.
Absolutely, and we see that quite a bit because there are things, as we mentioned, that Medicare is going to cover for that patient, but those activities of daily living, Medicare doesn't cover and really isn't designed to cover. It's designed to cover situations from which you expect to recover or recover to the point that you can go on about your activities of daily living. But as we stated, oftentimes people just need some assistance. People often think of home health care as you're home and you're bedridden. You're not. You just need some help, as you mentioned, with that eating, bathing, dressing, but it's not something that Medicare is going to cover because it's not designed for that.
And that's when you really need the coordination and consulting. If you're expecting to have surgery, give a private duty agency like Comfort Keepers a call. We can help you through understanding that. You have an upcoming seminar that you're going to be exploring more of your information.
Yes.
What's that topic going to be on?
We have an upcoming seminar, and it's called Medicare the Basics, or we used to call it Medicare 101. We really literally walk you through from beginning to end, all these little highlights I've discussed. We go in detail at the seminar. They're small, they're done at our office. They are allow a question and answer period at the end.
May 17th, 10 o'clock at their office. Give First Benefits a call. Give us a call if we can help you in understanding home care. We thank you for watching. Check out our shows on YouTube on our Sarasota Home Care. Thanks for watching. We'll see you again next week on Thriving on the Suncoast. Thank you.
Thank you, Michael.
Comfort keepers, 'cause there's no place quite like